we are receiving reports that there are increased amount of cases in Utah and Arizona. We had one confirmed case in Las Vegas last week. So that's what we're seeing right now as far as measles goes.
And how can we prevent becoming like our neighboring states where they're having this outbreak?
So measles is a preventable viral infection. We have a vaccine for it that children can get at age 1 and age 4. It's in the MMR, and it is an effective way of preventing measles infections and transmissions.
And how about seeing what's going on in Canada too, kind of a similar way of trying to prevent, becoming like that?
Yeah, Canada is no longer considered to be measles-free, is what I hear, and continuing to follow the recommendations given by the AAP for vaccinations for children would prevent the spread of measles and the transmission of measles.
What should parents and families be doing to protect themselves?
Follow the vaccine schedules will prevent measles infections. Also, when your children have fever, keeping them away from other children, so keep them home from school. That would also prevent transmission of all viruses, including measles.
Any other signs and symptoms besides the fever that parents should look out for?
So it starts with the fever. The other 3 very common symptoms of measles would be cough, conjunctivitis, which is pink eye, and something we call coryza, which is basically just a fancy way of saying a runny nose. And then those symptoms develop first, followed by the rash. Usually starts on the face and then spreads throughout the rest of the body. Very red, inflamed-looking rash.
You mentioned one confirmed case in Las Vegas. Is there any other recent data available for Southern Nevada right now?
There's always that data available on, through the Southern Nevada Health District. I'm not aware of other cases at this time, but there may be already some cases that have developed.
Anything else that parents should look out for, be aware of?
Yeah, the measles virus, just like any other virus, can go away on its own, but you can get very serious symptoms and outcomes from the virus, including encephalitis, which is infection of the brain. So if anything worries you, you can seek help and advice from a pediatrician, or if it becomes an emergency, we're always available at Sunrise Children's Hospital.
Any different protocols or anything going on here? Or I imagine you guys are kind of always being preventive and trying your best.
Yeah, infection control is obviously important, but, wearing a mask does prevent spread of most viral infections, especially airborne infections, and washing your hands, being vigilant around people who are sick with keeping your hands washed and staying away from close contact.
You guys have anybody increase of people kind of coming in worried that they might have measles?
Not at this moment, not yet, but obviously anytime it starts to become more prevalent in the community, people do get worried and will start to seek advice, and a lot of times it's nothing, but still we're here to help, and we're happy to tell you that it's nothing.
Is it at what point should they come into the hospital? Is it when they have the fever that's kind of lasting, or?
Anytime that you're worried about your child, you can come into the hospital, but things that should be really worrisome would be difficulty breathing, not acting right, signs of dehydration like not making urine, or just having really dry skin in general, dry mucous membranes, things like that.